June is Men's Health Month, and we're starting a conversation this morning about heart disease. It is the #1 killer in men, so we're going to get to it with Dr. Ahmed Ansari, the Chief of Cardiology for Memorial Hermann Southwest Hospital, right around the corner here. Doc, good morning. Thanks for being here.
Good morning. Thank you for having me.
So here we go. This is Men's Health Month, and we're going to get right to it with heart disease. And as a man with a heart that's beating right now, heart disease just scares me on the surface. I'm not sure I understand exactly what it is. Can you define it for me?
So there's a wide range of heart disease. So there's multiple structures within the heart. You can have something as simple as just high blood pressure. You can have blockages within the arteries of the heart leading to heart attack. You can have valve issues. You can have arrhythmias. Or something as severe as heart failure. The most common cause, or the most common type of heart disease, is going to be either high blood pressure or coronary artery disease, which is plaque buildup in the arteries of the heart, which we're kind of going to be addressing today.
So under that umbrella, how many of those things do we really have control over? How many are we born with? How many are just affected by our environment around us?
So yeah, exactly. Some of the conditions are congenital, it's something that we're born with, or degenerative. So as we get older, things wear out, and some people, like their valves may wear out sooner than other people. And some of the conditions, we actually do have a lot where we can control risk factors and try to mitigate any progression of the disease or even onset of the disease.
Okay, and how can we learn or know, or what are the symptoms? What should we be feeling when these areas are starting to find problems or things are starting to go wrong?
So very common symptoms that we get with any type of heart disease are going to be decreased exercise tolerance. You might notice that you may not be able to do the same physical activities that you used to do, chest pain, shortness of breath, palpitations. Often that's a warning sign for rhythm issues or electrical conduction system issues with the heart, swelling of your extremities, or high blood pressure and so forth.
Okay. And how do we test for these things? I'm sure there's a variety of tests that we can do.
So there's two types of tests. So there's screening tests based on just for the general population, and then there's tests that we do specifically based on certain risk factors and symptoms that you may be having. So if you don't have established cardiovascular disease, you should be seeing your primary care at least once a year. During that visit, your primary care doctor will assess your risk factors, see what they find, and depending on the symptoms, they can do a wide variety of tests like stress tests, calcium scores, check your cholesterol, make sure you're not diabetic, and so forth.
Okay, so where do we go from there? I mean, for long-term heart health, is it enough to just build up these good habits? Are there tests that we should get in each decade of life? How do we go from here?
Right. So I do like to do routine stress tests. So I think that's something that I definitely like to do.
When you say routine, what's that? Every month? Every year?
I would say about once every 2 years on male patients over the age of 40. But if patients have certain risk factors of early onset heart disease in the family or other cardiac conditions, then we do screen for those sooner. But this is just for the general population.
Okay, are there any other sort of general advice for those once we get past 40, or it's like, hey, unless you have a symptom and you're calling, there's no reason to do anything?
No, so your primary care will definitely be doing routine tests like EKGs. They'll be checking your blood pressure, making sure you're checking your hemoglobin A1C to make sure you're not diabetic. They'll be examining your heart to make sure they don't hear any murmurs or any other irregular heart sounds. They'll be doing physical exams. But again, a stress test, I think, is something that definitely every male should get over the age of 40. And I think along with a stress test, an echocardiogram to check for any or screen for any congenital heart disease or any degenerative heart disease.
And you think we should talk to our primary care about setting up a routine if we're above that age and we haven't already started?
Yes. So some primary care doctors actually provide that service within their office, and some primary care providers will refer you out to a cardiologist who then can do that testing.
What kinds of symptoms should we not ignore at any age when they happen?
I think chest pain with exertional activity. That's one thing that...
What would be an example of that? Like I'm playing sports and I feel so...
You'll be going up a flight of stairs and all of a sudden you'll feel like a chest heaviness, and then you rest a little while, it goes away, or you may be playing sports or something like that. And that's something that's really indicative of something going on. And so I think that, along with shortness of breath.
And is it a one-time thing? Is it like, okay, you know what, maybe because sometimes we'll make excuses. Say, oh, I'm just dehydrated, or it's just hot out today, versus is this something we're going to be feeling repeatedly? If I walk up the steps today, then when I do it tomorrow, I should have this same feeling. Yeah,
it should be kind of predictable that you're getting these symptoms often. If you get it just one time and it never reoccurs, and for months and months after that, you're fine. That must be just some a fluke or something. But if it's something that's happening routinely, and then definitely it should be something that you don't ignore. Also, chest pain that doesn't go away. So sometimes patients, I'll have patients come in with a heart attack and they're like, yeah, the chest pain started 3 days ago and I thought it would go away and I kept waiting and waiting, and
that's where the problem
that should be a
starts.
problem. If you have chest pain and it's just not going away and we don't have any explanation for it, then you should definitely seek emergency treatment for that.
Indeed, yeah. I mean, some of these things, you want to be tough, you want to be strong, but we really just shouldn't ignore.
Right.
I'm glad we got the talk going. Dr. Ahmed Ansari, Chief of Cardiology at Memorial Hermann Southwest. It was great to meet you, and thanks for your help today.
Thank you for having me.